Bismillahirrahmanirrahim. Assalamu alaikum. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel, Health Education. Today, I want to share some exciting news about a new medication called Resmetirom, which is showing great promise in the treatment of fatty liver disease, a condition that is silently affecting millions of people around the world, including right here in Pakistan. Let's start with a quick overview. Fatty liver disease is a condition when excess fat builds in your liver. This can lead to liver inflammation, scarring, which is called fibrosis, cirrhosis, and even liver failure over time. What's alarming is that most people with fatty liver disease have no symptoms until the damage is already serious. It is often found in people with obesity, diabetes, or high cholesterol. Now let's talk about Resmetirom. It's an oral medication that has been under development for years and has been recently approved in Pakistan for MASH, previously called NASH with liver fibrosis, a more advanced stage of fatty liver disease. So, what makes it special? Resmetirom is a thyroid hormone receptor beta agonist. That might sound technical, but in simple words, it activates special receptors in your liver that help burn fat and reduce inflammation and scarring without affecting your heart and other organs. In recent clinical trials, patients taking Resmetirom showed reduced liver fat, improved liver enzyme levels, and less fibrosis progression on liver biopsy. And the best part, it was well tolerated with mild side effects like diarrhea or nausea in some cases. This drug is not for everyone. It's specifically for people diagnosed with MASH with significant liver fibrosis, confirmed through a special blood test, imaging, or biopsy. It is important to remember Resmetirom is not a magic pill. It works best when combined with healthy eating, regular exercise, and managing diabetes or high cholesterol. It's a new weapon, but lifestyle changes are still the foundation of treatment. In summary, Resmetirom offers a new hope for those with fatty liver disease at risk of liver damage. If you or a loved one of you has been diagnosed with fatty liver or MASH, speak to your doctor about whether this new treatment might be suitable. And remember, prevention is still the best medicine. So stay active, eat wisely, and get your liver checked if you are at risk. Thank you for watching. If you found this video helpful, don't forget to share it. Together, we can raise awareness and fight silent diseases like fatty liver. Until next time, this is Dr. FAROOQI signing off. Stay healthy, stay informed. Khuda Hafiz.